Back to school coverage is continuing this morning. Certainly these are anxious times for so many students, teachers, and parents as in-person learning has resumed for the first time in more than 6 months.
But not everyone is back in class, and with so many unknowns about the virus, there is a chance remote learning might return for everyone at some point. Being prepared for every possible scenario is key, according to Dr. Jennifer Jencks from Bradley Hospital.
The amount of anxiety that we're seeing, and we're getting phone calls through our Kids Link hotline, has really gone up dramatically.
Dr. Jennifer Jencks is the director of the Access Center at Bradley Hospital and the assistant director of Lifespan Pediatric Behavioral Health Emergency Services.
I think most kids have the resiliency to rebound from whatever comes their way. I think it's harder as we get older to be resilient, so I think there are a lot of adults that are struggling even more than the kids.
Back in March, the decision about not going to school was made by the governor for every family. Now many families have been given the option of virtual learning, a hybrid plan, or going back to school full-time in class. Having a choice can often add even more stress deciding what to do.
I think one of the healthiest things families can do is talk with their kids and involve them in an age-appropriate way in the decision-making, to explain how they're making the decision versus just saying this is what you're doing.
And how parents have these discussions with children is also important.
And they are reading you at all times to sort of see, are things going to be okay? And it's not necessarily the language that parents are using, it's how the parents are conducting themselves. So if they're speaking rapidly with a very agitated voice, kids are going to pick up that things aren't okay. Even if they're saying it's going to be fine, it's going to be fine, they're not going to believe the tone of voice.
Dr. Jencks also said it might be a good idea to have a space at home designated for homeschooling, even if your child is going back to class, because they will have an easier time adjusting if changes are made during the year. Working parents should always have a backup plan in place for childcare. We're all facing many unknowns, and if you take time to plan for every scenario, it will be easier to adapt on the fly. And nutrition is also key. Eating healthy, very helpful for managing stress.
One of the most important things that parents and teachers can be doing is to be reassuring to the kids that there are a lot of experts involved, there are a lot of people who care about them involved and want the best thing for them and are working to put that in place. And that alone will create sort of a resiliency, a protection from the trauma of this experience overall.
So in addition to a good diet for kids and parents to manage stress and anxiety, Dr. Jencks said one of the best coping skills to reduce anxiety and stress is exercise, which can help release some of that negative energy from your body.